Okay. Thank you so much. Well, I've tried to organize my ideas responding to the three challenges you gave us, and I also would like to make a comment on the proposal of the Open Working Group for Sustainable Development Goals, because this touches deeply in the House, and it is very important for us. So, what would I like to highlight? And I think basically the amount of amazing experiences, practices, and interventions done throughout the world and through this talented um, community and health care people. I think this talks by itself that we're trying to respond to the need. And I think this is a very important issue to tackle. They have shown us, and we have seen in the region of the Americas, that we have to go to the local level. We cannot work at even at the national level. Not, of course, less at the regional level where we are, and furthermore, more difficult at the global level. But from up there, we can do things to try to help improve situations. And this is like the big challenge based on what we have seen in a tremendous amount of lessons to learn. Now, this reality of working in the local is another call to build metrics in the local. And this is probably one of the biggest challenges. We've seen it in the Americas, and we have very good countries. And we have very good countries with good information systems. However, you saw the chaos I showed you. And why doesn't it work? Sometimes it's lack of funding, sometimes it's lack of technology, sometimes it's lack of competencies of whoever's guiding the boat. So those lacks, I guess, are opportunities to support in those different levels. And then one common denominator in most of the things we heard from all countries that presented and that we've seen in the region is the strength of networking. Networking has demonstrated to be a very good tool to really share, exchange, and transfer not only knowledge, but also technology and practices. And I think this is something we should enhance. And I think this is also a good opportunity for the private sector. Being said that, I think networking, and particularly in PAHO, we have an occupational disease network because of the big problem, because we need to solve the problem of diagnosis. A good colleague of mine says that workers get sick of what the doctor knows, and if the doctor doesn't know, well, the worker doesn't get sick. Simple. It's a very easy equation. How do we enhance occupational medicine and occupational practices in the schools of medicine, in the house of Academy? This is a big must. And not only in medical school, in nursing school, in engineering, in architecture, in economics, in housing, etc. And then is when we realize, well, workers are where? In all the economic sectors. And we have to deal with all the economic sectors. That is why when we think about health and all policies, we don't want to be the actor, but we want to be sure that the people in economic sectors are healthy, happy, and productive, and motivated to continue their lives. This is what we would like to see. So, I mean, this is let me see, this is the wrap up over there. Now, the second point is, how can we accelerate the economic approaches to fill the gaps? And I put the last three, fill the gaps, with an emphasis on that. Because yes, many times we do have the knowledge, but we don't have the technology. Many times we have the, how do you say ganas in English? The desire, thank you. The desire to do something, but we don't have the how, or we don't have the who. And then there is a big opportunity to collaborate And it doesn't necessarily mean to collaborate with WHO, with PAHO. Maybe it is, let's focus, like we're trying to give an exact example, domestic child work. If we focus all on that, if all the pennies would put in the same bucket, maybe we could make a difference. And then finally, I mean, I suffer as a health worker, having done general medicine, having done many things. I visited enterprises, I've been in mines, I've been in all kinds of settings through my work. I have the chance to visit almost all the countries of America and see the beautiful, the good, the bad, and the ugly. And there's so many things to do that, I mean, what we need is people to jump in the bus and come with work with us. So this is like a big call. All hands of opportunity, they're here. How we do it, this is a question of sitting down and thinking and putting together the puzzle. Now, how to accelerate the issue? There are several mechanisms that are available on, I guess ILO has them too, because I know their network. But in PAHO, we have our network of collaborating centers. It's the biggest of the WHO in occupational health. We also have the friendly partnerships with local authorities to assure that what we ever do is going to be really inside the country, not inside the consultant, not inside the NGO that's working. It's in the country, because this is where we need to work. We need to really grow roots down there. So this is an opportunity also to see if we can do things there. We have several very nice candidates willing to do things with us in the countries. And we have several regional initiatives ongoing, like, for example, I'm going to talk exactly about one, prevention of occupational cancers. We are now working with 7 countries. We did a workshop last month, training on how to build job exposure matrices to carcinogens, because if we eliminate exposures, we eliminate cancer. Simple. It's a simple equation too. So, I mean, these kind of initiatives, but we need to train the people. We have to move. Of course, we get support from other regions, from our colleagues, from our collaborating centers, because we all do this because we have a strong collaborating center network. And finally, maybe the most painful and the biggest lack of all is the invisibility that numbers cause. I'm talking about the rural sector. I'm talking about agricultural workers. And of course, I know this is difficult to address. I've been there. I've been organizing in the past 8 years with people in trying to address rural workers' problems, and it's really difficult because of all kinds of barriers, distance, geographical, money, etc. But this is another big debt. I mean, agricultural settings give us the food. Why can't we give them a hand for health? Final comment to the document that was our homework. It has been a long run, I must say, for the health sector and for WHO and for PAHO to get concrete health statements in this declaration. But we particularly thinking about the epidemics of occupational diseases, and I didn't mention one of the diseases that we have, we're tackling very strongly, and thanks to the support of our collaborating centers, we're trying to start interventions to eliminate the epidemics of chronic kidney disease that we have in Central America, that is killing young men between 20 and 35 years of age, and we still don't know the cause. So, I mean, this type of things are the things that really make us think that we need to put in page 7, number 3.9, we need to add, by 2030, sustainable reduction of the number of deaths and illnesses from hazardous chemicals and air, water and soil pollution and contamination. Yes, and let's include occupational hazards, please. Please, yes, air pollution and work outside of closed environments is important, but inside the shops we have a lot of problems too. So we need to include it there. And the other thing we would like to hear also is protect labor rights and promote safe, healthy, the word healthy, just that, and secure working environments of all workers, including migrant workers, particularly women migrants, and those in precarious employment. Those were the only two things that we would really like to push, and we would appreciate that you support, because this will make the roadmap to really work stronger on these things. Thank you.